I've received so many questions about what is normal sugar, what is abnormal blood sugar. So today I'm going to explain everything clearly from normal blood sugar to pre-diabetes and to diabetes. So the test that you need to do to confirm whether you have normal sugar, pre-diabetes or diabetes include fasting blood sugar. Sometimes you can do random blood sugar or you can do glycated hemoglobin or HbA1c. So fasting blood sugar is done if you stay without food for at least 8 hours but not more than 12 hours. But remember, during that period you can take plain water. You cannot take tea, you cannot take coffee, but plain water. While random blood sugar is done when you have already eaten, but ideally the best random blood sugar is done in the hospital. When you come without eating food, they will do the fasting and they will give you 75 grams of glucose. Then 2 hours after giving you that glucose, they will check your blood sugar. That is the best random blood sugar to do. Then glycated hemoglobin can be done whether you have eaten or not. So fasting blood sugar, what is normal fasting blood sugar? Normal fasting blood sugar according to the WHO is between 4 to 6 millimoles per liter. So once your blood sugar is between that range according to WHO, you're normal. While if your fasting blood sugar is between 6.1 to 6.9, you are pre-diabetic. It is also referred to as impaired fasting glycemia. So, but if your blood sugar is up to 7 millimoles per liter and above, that's the range for diabetes. So if you have symptoms such as excessive urination, excessive thirst, weight loss and the rest, you only need one value. But if you do not have any symptom, you need at least two values. What is normal random blood sugar? Normal random blood sugar after OGTT has been done. That means they have given you glucose 2 hours later. You check your blood sugar should be between 4 to 7.7. If it is between 7.8 to 11.0, you're pre-diabetic or you're at the border, as people normally say. So it is also referred to as impaired glucose tolerance. But once your blood sugar is up to 11.1, you're diabetic. But what if you checked it without doing that OGTT? The normal is between 4 to 9. If it is more than 9, it's abnormal. That means you need to do either fasting blood sugar, OGTT or glycated hemoglobin to know your state. But if it is up to 11.1, it is diabetic. But if you have symptoms, you only need one value. But if you do not have any symptom, you need two different values on different dates. The next is glycated hemoglobin. Glycated hemoglobin is a accumulation of both your fasting and random over the period of 2 to 3 months. So the normal glycated hemoglobin is less than 5.7%. If it is between 5.7% to 6.4%, you have pre-diabetes. If it is up to 6.5%, you have diabetes. So I hope you understand. So these are the range from normal, pre-diabetes to diabetes. If you are already diabetic, what is expected? So if you're diabetic, you are expected to have a fasting blood sugar of between 4 to 6 if it is well controlled, according to WHO. However, according to American Diabetes Association, it can be between 4.4 to 7.2. Your random as a diabetic patient should be between 4 to 9. That's good control. And your glycated hemoglobin as a diabetic patient should be at best less than 6.5%. But sometimes less than 7% is still okay. Hope you understand what is normal and what is abnormal.